Okay, Jay, you're live on YouTube whenever you're ready.
Okay, good morning, everyone. Welcome to the first Adult Social Care Scrutiny panel meeting of 2022. I'd like to wish you all a very happy and especially healthy new year. We'll go sit on the agenda. Have we any apologies for absence?
Yes, Chair. Apologies have been received from Councillor Jones.
Okay, thank you. Have we any declarations of interest? I can see no hands, so we'll move on. Item number 3 is minutes of the last meeting on the 8th of December. Can we agree on those, please?
Agree, Chair.
Yes. Yes, we agree. Right, item number 4, we move on from number 4 to number 5, which is the integration of health and social care verbal update from Eric Scully. And Eric, will over to you, Eric.
Thank you, Chair. I will be brief this morning. I think last time when we spoke, I anticipated having a bit more comprehensive of an update to bring you around some of the work that might be going on around the integrated care system. But in fact, that's not the case today. I think really it's become clear as we went into the Christmas period that all of the efforts of the NHS have been focused on managing the demands of the pandemic and the rising numbers that we see within our community. So I think I did mention at the last meeting that we now have the Chief Executive appointed for the integrated care system for the North East, and that's a woman called Sam Allen, who will be joining us from. She has extensive experience working within NHS trusts. She comes as a chief executive from a trust down the south coast and will be moving up to pick up the CEO role for the integrated care system. Now that was anticipated, I think, to happen in January, but I've seen a communication that came to our chief executive yesterday or the day before, and it was a central government announcement that the go live of the integrated care boards and by extension the integrated care systems, which was anticipated to take place on the 1st of April, has been now delayed. And won't take place, subject to parliamentary time, won't take place now until July. So I think that's a reflection of the challenges that the NHS are facing. I think it's probably a relief to some extent for us from an operational perspective. It means that we avoid a little bit longer the kind of the upheaval or the potential upheaval that goes with thinking about integrated care system. And it means we've got a bit more continuity because the current CCG arrangements will remain in place until July time. So I think we're a little bit in limbo until we understand quite what's going to happen now, hand in hand with that statement that there's going to be a delay. So I think that's probably about the extent of what I can tell you about work on integration that's gone on over the Christmas period, because it has been dominated by COVID. It would be wrong of me, I think, probably not to mention the work that we've had going on since last time we met around the response to the pandemic. I think we have been we've been involved pretty much in calls on a daily basis, well, not actually a daily basis, with colleagues from the NHS and particularly from Clinical Commissioning Group and from the acute hospital around our work on hospital discharge and making sure that flow through the hospital system and back out into the community is maintained. I'm pleased to say that we've managed to do that with very few exceptions so far. We managed through the efforts of, and I've got to put my hand up and give the credit to our commissioning staff, particularly Louise Grabman and her team, for managing to bring some additional home care provision on in the run up until Christmas. And that's been a bit of a lifesaver for us, figuratively. But actually, it's been much more expensive to bring home care on than it has been previously. And that's a reflection of the challenges that providers are faced in recruiting staff at the minute. So unlike some local authorities, until now, we have been able to be assured that we've got domiciliary care packages available for people in hospital discharge. It's becoming more fragile at the minute. We're really only able to work with essential visits at the minute. And we're doing what we can to make sure that we conserve the availability that we have, I think, because we anticipate the pressure increasing over the next month or so. From a hospital perspective, our hospital team has worked through Christmas and New Year. I think we had staff working on the wards every day with the exception of New Year's Day. It's been challenging, and the team have done a fabulous job. We've managed to keep the system, the wheels going round there from a social care perspective, I think with few exceptions. There are always some instances, situations that trip us up, but they've done really well there. I think the real challenge for me at the minute is probably because we have outbreaks in a number of our care homes. And now that doesn't necessarily equate to serious illness. But as soon as we have an outbreak within a care home and residents who are in the large part, triple jabbed by now, so unlikely to develop really serious illness. But as soon as we have an outbreak in a care home, then that care home becomes closed to further admissions. So actually we were in a situation yesterday where about half of our care homes were closed to admissions. And that situation can change really quickly. So that situation might deteriorate. Once you have an outbreak in the care home, you have to wait 28 days following from the last case before you can reopen that care home to admissions. There's a conversation at the minute about whether that 28-day period will reduce to 14 days, and I'm meeting with other DASs and directors of public health today to talk about that on a regional basis. But the challenge for us is that period of closure is a rolling period. So if one resident catches COVID and you start that rolling period of 28 days or 14 days, and then 10 days later someone else gets it, you reset the clock and run it on again. So we could very easily find ourselves unable to access the majority of residential care capacity for new admissions. Now, we're not unique in that. I think that's a situation being faced by Redcar today and by other authorities all across the northeast and probably the country. But it's a very challenging situation for us to try and unlock. We're sort of doing two things at the minute. One is we're exploring available capacity in extra care housing at the minute that we might have, because we've got domiciliary care already built into those systems, to see whether or not we can facilitate hospital discharge by discharge into extra care housing temporarily to get people out of hospital beds because the hospital is under such pressure. And we're also looked, you may remember, councillors, you may remember something called designated settings that we talked about during the first lockdowns. And that was where people were being discharged from hospital who were COVID positive. And the answer was that there would be some care homes who would get an additional accreditation, if you like. CQC would inspect and would allow them to register as a designated setting. And that meant there was a particular level of infection control and protection measures in there. And we could discharge individuals there who were COVID positive. Now, we haven't used designated settings heavily within Middlesbrough. We've had a provision, but it's always been underutilised. But I think now, if we have the bulk of our care homes potentially getting gummed up because of outbreaks, then it may well be that a designated settings arrangement is the only way that we can discharge people quickly from hospital and free up space at James Cook predominantly. So we've got a home care provider who is able to offer us 2 units on 2 separate sites in Middlesbrough where there are 15 beds in each unit. So we have a potential to increase our designated settings capacity up to about 30 beds. That has to be authorised by the Care Quality Commission, who are looking at it at the minute. But most importantly, it has to be commissioned by the hospital trust, not by us. And that's because the care homes have been unable to obtain insurance indemnification for taking discharges in designated settings arrangements. Government have put in place a central indemnity scheme, but it's the acute trusts that have to cover that. So we're working with the acute trust at the minute to support them in commissioning some additional designated settings capacity. We're doing that as a matter of urgency. So I think it's a really dynamic situation at the minute. I think you should be aware that the COVID rates are sort of rocketing up nationally. The extent to which that's being driven by Omicron or whether it's older variants is kind of hard to tell at the minute, because you only find out whether it's a variant of concern, whether it's Omicron, sort of after the fact, if you find out at all. But the rates are increasing alarmingly. So we're monitoring this, as you can imagine, as a kind of health and social care sector on a daily basis. I'll stop there and see if there are any questions.
Yes, thank you. I have just a quick one. Are relatives allowed to visit their relatives in care homes when they have COVID?
It'll very much depend on the individual care home. whether or not they've got an outbreak, whether they've not got an outbreak, whether the care home manager feels that they can facilitate that visit. And I appreciate that that's and that feels like an unsatisfactory answer, but ultimately that's where we once again find ourselves. There was substantial investment went into care homes for arrangements to try and facilitate visits during the first kind of lockdown periods, and that worked to varying degrees across the care homes. At the minute, our priority, I think, has probably got to be to keeping care homes open to admission and trying to reduce the number of care homes where we've got outbreaks. There are particular restrictions around visiting, obviously, if there are outbreaks. And our commissioners, again, we're talking to care homes pretty much on a daily basis, as are our public health staff, to support them in making those decisions about visiting. But ultimately, it's about recommendation from Director of Public Health, but ultimately the decision taken by the care home provider. You'll also note that several hospitals across the region have also taken a decision to suspend normal hospital visiting. I mean, there are exceptional circumstances in all these cases, but normal visiting has been suspended at a number of our acute hospitals, I think including North Tees, but as of yesterday, I don't believe it had been suspended at South Tees.
Okay, thank you. I see Councillor Cook. David, do you want to ask a question?
Yeah, thanks, Chair. Having had to visit James Cook just before Christmas, I noticed that the ambulance bays were completely full. I mean, this is part of the problem. I think North East Area Ambulance have declared an emergency, so people are being told they have to, where possible, make their own way to the hospital. But that would say that A&E was pretty full, either with COVID cases, whatever. I mean, this would have a knock-on effect to anything, because if there's a COVID case in a care home and things like that, if there's no ambulance available, that's surely going to be a problem. I presume we have other things in case for that.
Yeah, I'm not a spokesperson for the acute hospital or for the NHS, councillor. I know that sort of looking at our dashboards, certainly between the sort of day or two before Christmas and a day or two before New Year, I think the numbers of inpatients with COVID had pretty much doubled at James Cook. So the numbers are going up substantially. What we're not seeing yet on the basis of the data I've got is the sort of increases in critical care patients that we saw during the first waves, and my reading of that would be that you know, either the benefit from a large percentage of our population being vaccinated, or that in combination with however the Omicron variant might affect us differently from earlier variants is thankfully not translating into the same number of serious illness cases and long hospital stays. The flip side of that, or the counter argument to that, is that we haven't really seen the full impact yet of the sort of socialising that went on over Christmas, and we probably haven't felt the full bite of the Omicron variant as of yet. Now, we do have a percentage of our population, and I don't have the figures to hand, the accurate figures, but we do have a percentage of our population in Middlesbrough who are, for whatever reason, unvaccinated. And for that percentage of the population, I think we're waiting to see whether or not, if the Omicron variant becomes prevalent within that group, and we know that it's efficient at finding people who are unvaccinated, that's when we may see it translate into hospital admissions. And ultimately the problem, and I'm about to stop a second on this, ultimately the problem faced by the acute hospital at the minute is less the number of individuals with COVID, and hospital may disagree with me, but my reading is less the number of individuals with COVID they've got in there, and more to do with staff who are isolating because of COVID. That's certainly the issue for North East Ambulance Service at the minute. Yesterday they were reporting approximately 20% of their staff down because of COVID isolation. So in a way, some of these precautions that we're taking at the balance between, I think, the fear of acute illness and the fear of our services being overwhelmed because of staff off, that balance seems to have shifted a little bit over the last few months, and now the immediate threat to us seems to be the impact on service continuity because of staff sickness, I think.
Thank you.
Okay, David.
Yes, thanks, Chair.
Councillor Walker, Jeanette, would you like to ask your question?
Thank you very much, Chair. I'll just lower my hand. There we are. Yeah, thank you very much. Thanks, thanks, Eric. Thanks for that very involved sort of update on what's happening. One of the things I would like maybe to say is that, you know, we've got to say thank you very much to all the staff that have worked continuously over Christmas and the new year, because it's not easy. And of course, with things as they are, it's been a very difficult time for everybody. And I'd like to say thank you very much to everybody for doing that. And I hope that's passed on to everybody. I'm just wondering about with the care homes. I know that there's a shortage of lateral flow tests available in everywhere, actually. I mean, I've been trying for the past 2 weeks to get hold of one, but and I'm just wondering, is that affecting the care homes? And of course, after that, they need a PCR test, and apparently there's shortages of that as well. So I'm just wondering how they stand on that with the lateral flow tests, and are we helping in that regard, or do we need to, or is that just for the government?
So,
Thank you, Chair.
there's yes, we are doing what we can to assist with that. We Directors of Public Health received an allocation of just a blanket allocation of test kits some considerable number of months ago, and that was at the time with a view to working with specific vulnerable groups of individuals, such as homeless people. And we were required to use test kits for those individuals and then submit returns back to central government. What has been in some respects slightly useful for us is that we didn't use all of those tests, and that I think is because there was a sort of just a kind of block number sent out to Directors of Public Health. So I don't know whether that has contributed to some of the problem, but it's certainly contributed to a solution for us locally and pragmatically at the minute, because it meant that lots of little local authorities had managed to establish small stocks of lateral flow tests. I've been speaking yesterday and today with colleagues at Public Health and colleagues in commissioning. And in fact, last week, we started having the conversation, and yeah, we're freeing up that small, relatively small stock, but that stock that we've got of lateral flow tests at the minute, and on a kind of prioritised basis, we're giving those to care home providers and domiciliary care providers so that they can get their staff back into operation. I think the instruction around the tests was about specific vulnerable groups, but actually, I mean, I'm quite happy. We've said to Public Health the priority has to be keeping those wheels going round in terms of our independent providers, because they are directly supporting vulnerable people. So yes, we are helping with that. And there's also been the recent announcement about, which I haven't managed to get my head around just yet, about the potential requirement not to have a PCR test following negative lateral flow tests at the end of a period of isolation. And I'm not going to comment on that yet because I don't understand it, but obviously that's potentially a positive change.
Yeah, thank you very much for that update. Can I just continue a second, please?
Yes, go ahead.
Thank you. You mentioned the PCR test. I mean, we just had a centre open in Hemlington to do vaccinations, etc. And I'm just wondering, what about the take up of vaccinations? Has that been halted in any way, or are we, you know, is that helping or not helping? There was an issue, wasn't there, regarding care home workers actually getting vaccinated at one point, and I think that was a problem.
Well, you'll remember that care home vaccination, the double vaccination, was made mandatory for our care home staff. So we've been around that sort of bump in the road. Some individuals decided to leave the sector, but we've sort of fielded that, and we're now into the period of trying to work out how we get the same level of coverage in terms of boosters for care home staff and provider staff. I think you'll forgive me, I've been running at standstill over the last couple of days, so that I don't have the up-to-date figures to hand yet. We'll get those tomorrow, certainly. The up-to-date figures around boosters and vaccinations.
Yeah.
I mean, the activity and the work around that has carried on and is going on this week. And I know that colleagues from Public Health are bringing an update to LMT tomorrow. So we'll make sure there's a focus on that, Councillor.
Thank you very much for that. Thank you. Thank you, Chair.
Okay, I see Councillor Higgins there, Teresa.
Thank you, Chair. Before I go any further, sorry I was late getting into the meeting. So I might have missed something at the beginning, but I was wondering, these places that they're going to send people from hospital to, do we know where they are?
We haven't had that confirmed yet, Councillor.
All right. And because I'm a bit concerned about the staffing, because of the virus. So could we be kept up to date to make sure that the homes or wherever the people are going to is properly staffed? Because if the hospitals are their staff losing, then you know, the care homes will just be the same. So it's a conundrum, isn't it?
Well, it's an absolute conundrum. I'm not sure whether or not you had joined the call at the point where I was giving an update that we have approximately 50% of our care homes in Middlesbrough. So we've got 30 care homes in Middlesbrough. There are about half of those closed to admissions at the minute. And that's in most part because they've got outbreaks in the care home. And that means we close to admissions for 28 days after the final sort of COVID case identified. We might be able to reduce that to 14 days. That's a conversation that's going on. We've got a couple that are closed because of staff gaps. The care homes have managed relatively well in terms of maintaining the staff complement, but they absolutely are under pressure around kind of recruitment, as all our independent providers are at the minute. I suppose that the designated settings, which is about that specific authorization to have a set care home where you can discharge people who are COVID positive, and that requires a particular staffing level, particular infection prevention control measures. The commissioning of that arrangement is between the acute hospital and the care home, not Middlesbrough Council and the care home. And in order for it to operate as a designated setting, there is a particular assessment gets made by the Care Quality Commission. So before we can operate, before the care home and the acute hospital can enter into that arrangement and start using it as a designated setting, Care Quality Commission have got to sign off on it. So they are required to say, yes, we think this is safe as a designated setting. That's in this instance, that's a Care Quality Commission decision, not a Middlesbrough Council decision. I think there probably will be a mixture of the care home staff and agency staff in there, but that's not to say the agency staff are not as capable and competent. It's not about nursing staff, because the NHS cover will be provided by the NHS for those designated settings. So I share the reservation is correct about staffing levels in our providers at the minute. But I think, if anything, within the designated settings arrangement, there's more scrutiny on it because of the nature of it rather than less.
Thank you, Eric. Thanks, Chair.
Okay, thank you, Councillor Higgins. Anyone, any more questions for Eric? I don't see any hands. Eric, as always, thank you very much for your update.
Thanks, Chair. It's a pleasure.
I'm going to move on now to item number 4, which is Tees-wide Safeguarding Adults Board Annual Report 2020-2021 and Strategic Business Plan for 21-22. We have in attendance Darren Best, who is the independent chair of the Tees-wide Safeguarding Adults Board. He's here to provide some information for us. So over to you, Darren.
Thank you, Chair. I'll say a bit, and Eric may want to say some things as well on the back of what I've said. But just for those members who A, I haven't met before, or B, haven't heard one of these type of updates before. And sorry, I should start by saying my connection's not great. I can only see about half of your faces. It keeps going in and out. So hopefully I'll get to the end before I lose my connection. But I'm just saying that just in case. Under the Care Act 2014, local authorities have specific responsibilities around safeguarding adults, which I'm sure most people will be aware of. And I'm conscious that some people may sit on similar type panels for children and safeguarding around children. The slight difference between children and adults, other than the obvious, is in terms of the safeguarding responsibilities, very much sit with a local authority in adults' world, if you like, whereas in children's world, the legislation is more around local authorities, police and health, albeit within adults, the police and health have responsibilities as well. But the responsibility under the Care Act firmly puts it with the local authority. Hence, each year we produce an annual report as the Teesside Safeguarding Adults Board, And I, as the independent chair, attend each of the health and wellbeing boards. Obviously, South Tees, Redcar and Middlesbrough have got a joint health and wellbeing board. I've already attended each of the health and wellbeing boards across Tees, and this is the second of the adult scrutiny meetings with the local authority representatives. I've still got Stockton and Hartlepool to do. But that's just as a bit of background with the Teesside Safeguarding Adults Board. In most areas, each local authority has a Safeguarding Adults Board. Here on Teesside, a decision was made some time ago that the 4 local authorities would work together and have a single board to cover all 4 local authorities. That's, as far as I'm aware, that's unique around the country. I know some areas where there are 2 local authorities who've come together, but I'm not aware of anywhere else where 4 local authorities have come together. The advantage of that is obviously it means we've got some economies of scale. We've got a business unit that operates across the whole of Tees, and essentially it means we can do more stuff, certainly in terms of business, than I would argue a single local authority would probably be able to afford to do in the current financial climate. So we, as a board, we produce an annual report. And we present that, as I am doing today, to yourselves and others. As I said, for those who were on the call right at the beginning when I was speaking to Chris, I don't intend to go through all 18 pages of the report. I'm sure you'll be pleased to hear, given the agenda items that you've got. But the report essentially sets out the work of the board during the period 2020-2021. I became independent chair in October of, I was going to say last year, it's not last year anymore, is it? October 2020. So this report actually covers a period that covers when Anne Baxter, with the previous independent chair, was still in post up until October. So from April to October, and then obviously it was me between October and April. So I just mentioned that really out of courtesy to Anne, and who I do mention in the forward of the report as well. But within the report, and I'm happy to take questions at the end on, there's some figures in there, there's talk about the board, there's mention of the legislation that covers adult safeguarding work, some of the training activity that we've done, some of the communication and engagement activity we've done, our priorities, and then an important part of the work of the Safeguarding Adults Board is in relation to serious adult case reviews and some of the ones that we've done during that year. But I'm going to just pick out some positives and some challenges, and then I'll briefly mention the data, if I may, Chair, just towards the end. So I think the positives to report back to yourselves is the breadth of partnership work that we've got operating across Tees. The report itself highlights the various agencies, both statutory, voluntary and non-statutory agencies that are involved in safeguarding adult work, and in particular the work of TSAB, and the breadth of involvement and engagement that we have is really, really good. And I know there's some, obviously Dorothy represents yourselves at TSAB, as does Eric. I think the other thing for me, having been the chair now for just over a year, is I've seen a genuine openness to learning and development across Tees. We have a very active serious adult case review subgroup that's actually chaired by the Director of Adult Social Care from Hartlepool, Jill Harrison, but she does that on behalf of all 4 local authorities. And again, I think that's testament to the level of partnership work that's happening across Tees, that you've got a Hartlepool director who is quite often chairing meetings about cases that have happened in Middlesbrough, Redcar, or indeed Stockton. But there's a real openness to that learning. I've certainly, as an independent chair, I haven't felt any major pushback or any issues around people wanting to take on board learning when we have those serious cases. And obviously a serious case, for those that are not familiar, is a case where an adult dies and or suffers serious injury, and we feel that there is learning to be had because of the way that agencies have worked together in that particular case. And as I say, the report covers some of the cases that we've reviewed during the last period, and there is other active cases ongoing as we speak. I think the other thing to talk about is you'll see within the document that the priorities for 21-22, so the year that we are in now, we've changed the focus of our priorities into I statements. And what I mean by that is the priorities for the board now come from the perspective of what it feels like or what it would look like if we were achieving what we would want to achieve from the perspective of the service user or the carer. So that well, you can read them in the report, but they come from their perspective to remind us constantly that that's the job that we're here to do, to provide services to and for them and with them, importantly. Another positive is that 4 of the 5 performance indicators that we set ourselves in 2021, we met. We missed one of the performance indicators by 2%, and that was we set ourselves a target of 75% of being satisfied, 75% of people being satisfied with the outcome of their investigation or their inquiry, and we achieved 73%. So we were 2% off that, albeit data for this year is looking increasingly promising that we will hit that target as well in this reporting period. But the rest of the targets that we set ourselves were met. I think some of the challenges, I've obviously listening to the discussion that happened just before my agenda item, and the complexity that adults safeguarding operates in is astounding, quite frankly. And I did note that a few people have paid tribute, quite rightly, to the work and efforts of the people doing the job of looking after vulnerable people, in this case in Middlesbrough. And I would simply echo that as the independent chair, to have observed and watched how professional people have still managed to provide safeguarding services in the times of COVID in particular, when they didn't have the access to people, they couldn't do their job in the way that they've been trained to do it and have done it, if you like, over many years. Is nothing short of astounding, and they really do deserve the praise and support of those people that are both managing them and those people who are making decisions, if you like, around what resources, etc., that they get. But it's fair to say that COVID has added a level of complexity to safeguarding, as I've said, for the reasons I've said. But my sort of background in safeguarding goes back a couple of decades. For those who don't know me, my previous career, I was in the police. My last job, I was Deputy Chief Constable in Northumbria Police. But I've been involved in safeguarding since the late 90s. And when I first got involved with adult safeguarding, some people may remember the No Secrets document that came out in about 2001. The focus at that stage was very much around physical abuse, sexual abuse, financial abuse and neglect. Quite a narrow view of adult safeguarding. Over the next couple of decades and where we arrive today, the breadth of adult safeguarding is huge. And we're now talking about things like homelessness, we're talking about self-neglect, we're talking about trafficking. The breadth of issues is huge, and your people who are doing the roles that they do in Middlesbrough are dealing with those complexities day in and day out. And that's from an adult safeguarding board perspective, that's one of the things that I'm keen for us to understand, and how some of those complexities link together. And the likes of Eric and others help me to do that very well. I think another challenge for us is to actually hear the voice of the service users and carers. That's something I'm working on with the board at the moment, around when we have a board meeting, how do we hear what it actually feels like to receive the services that Middlesbrough, Redcar, Stockton and Hartlepool provide, and what are the good things that we do, what are the things where we could do things better, but how does it actually feel, and hearing that voice. I think that's really important in the work that we do, and that's something that a challenge for us to hear that, given the breadth of issues that we're dealing with in adult safeguarding. It's really difficult, if you like, to sort of have one person who could tell us all of those experiences. It's going to be a range of people that we're going to have to listen to and hear from. I think it would be wrong of me as an independent chair operating in Teesside not to talk about domestic abuse and how that impacts across the board. And when I talk about complexity and the different types of adult safeguarding issues that we are dealing with, the one factor that we virtually always come back to is around domestic abuse and how that impacts on families, and how that links to children's safeguarding, how that links to issues such as homelessness and trafficking, financial abuse, etc. So quite often there is a link to domestic abuse, and sometimes that can be a hidden issue when we're dealing with something more substantive. But I think it's that whole theme of domestic abuse is something that across Tees we really do need to do something about. And I know that there's work being led by the Police and Crime Commissioner's Office through Safe Lives that each of the local authorities are involved in to try to improve our services around domestic abuse. And I very much welcome that and pay a keen interest in see how that develops over the course of the next year or two. And then the final challenge, I think, is around staffing and training. And Eric's mentioned some of the issues already, some of the sort of here and now issues about lack of resources as a result of COVID and people testing positive, etc. But I actually have another role since I've retired from the police, which is I sit on an NHS trust board, not in this area, up in Northumberland. And I hear the same issues all the time around lack of resources, lack of staff, and the fact that, particularly in the care sector, we're now competing, or those sectors are competing against the likes of Amazon, who are paying £2,000 or plus sign-on fees to people who maybe otherwise would work in the care sector. So some real challenges, I think, that local authorities, health professionals, and indeed some other organisations need to get their heads around and think about how they're going to support the staff that exist, and indeed the staff that we will need over the next few years to continue to provide safeguarding services. And obviously the link bit to that is to make sure they are properly trained and that they've got the skills and they're equipped to be able to deal with the issues that they're presented with. And I guess my role as independent chair is to challenge the likes of Eric and challenge other partners around on the board to say, well, how are we doing that? And obviously then squaring that circle, I'm here today to say, I'm doing that, but that's the responsibility, if you like, very much sits with local authorities. In the case of Middlesbrough, Dorothy and Eric are your representatives, but obviously you're a committee who should be hearing about these things as well. The final point I'll make, Chair, is around the data. I'm not going to go through loads of bits of statistics and stuff like that, but one of the things that I will say is that we're constantly asking ourselves, and Eric, again, on behalf of the 4 local authorities, chairs the performance subgroup. So he chairs that on behalf of all 4 local authorities. And Eric and I have had some quite lengthy discussions around data and what it means and what it doesn't mean and what conclusions we can draw from it and what we can't and what we can hypothesize. And it's really difficult to draw black and white conclusions from the data. But one of the things that we do look at is what is the general trajectory around reports of adult safeguarding being received, and then from that into each local authority, and then from that, what percentage of those cases are then converted into what we call a section, or what is called a Section 42 inquiry. That's a formal investigation under legislation, if you like, under the Care Act. And the double-edged sword to this really is on one hand, you would think, well, if the numbers of cases are going up, and indeed the number of investigations are then going up, is that a good thing or a bad thing? Is it a good thing because people are more aware and therefore more things are being reported and we're dealing with more things that otherwise we may not have? Or actually, are things going up because we've got this huge problem that we haven't got a grip on and things are out of control? My personal view is it's more the former, because I think the amount of work that we've done as a board and within each local authority around promoting adult safeguarding and raising awareness around it, I still think we're on an upward trajectory around we can expect to see more cases because people's awareness of when somebody is being abused or when something's concerning them, that they might put that call into the local authority or report it to a healthcare worker or whoever that maybe in the past they wouldn't have. So I think the trajectory is going up over, I think is a positive thing, but equally, I know it has been picked up in the media in the past and you could put a negative spin on it. But that's my view, but there isn't a definitive answer to it. What I can say is, though, we also look at that conversion rate from the inquiries or the numbers into the formal investigations. And if the general rule of thumb is about 50%, if you look at national averages, seems to be about right for that. And in 3 of the 4 local authorities, That's pretty much what we're seeing, and if anything, slightly above the national average. And Middlesbrough is one of the three where I haven't got any concerns around that data. We are heading in the, if you like, the trajectory is right, and the percentages that have been converted into investigations is above that sort of 50% threshold. So I haven't got any major concerns with the data in Middlesbrough. But as I say, it's one of those topics where we could talk about numbers for hours and hours, and I'm not certain we'd actually get to any firm conclusions, or certainly Eric and I haven't got to any firm conclusions on the back of the discussions that we've had. So with that, Chair, I will leave it at that. I'm very happy to take any questions, but obviously the report is there for information and assurance, given the role that the local authority has under the Care Act 2014.
Okay, thank you, Dan. I see two hands up. David, you had yours up first, so Councillor Cook, go ahead.
Thanks, Chair. Just concerned about page 11 of the report, where it says location of adult abuse and 35% in a care home. I presume that's, well, I suppose you could describe abuse as anything, neglect, food or whatever, but it just concerns me. 36% in a care home. That's a little bit worrying.
Yeah, I think the settings of where abuse reports have come from, we certainly saw during COVID and during the lockdown period an increase in the numbers, if you like, that were being reported from care homes. That's lessened off in the last 12 months. Obviously, this is the reporting period from April 2020 through to end of March. Sorry, 1st of April 2020 to the end of March 2021. But yes, I think you're right to be concerned, and I think it's right that that the local authorities, obviously alongside the CQC, pay careful attention to what is happening in care homes and indeed the levels of care that people are given in those places. But I don't know if Eric would want to say a bit more, given the role that the local authority has around care homes in particular.
Chair, may I say something briefly on that? I know
Go ahead, Eric.
Until a couple of years ago, or possibly even more recently than that, councillors, care homes accounted for more than 50% of the concerns in Middlesbrough. And I think what we need to remember is that when we rolled out training around safeguarding sort of years ago, the care home staff are actually the easiest in a way to reach in terms of establishing that routine of working, so that the concerns that come in from care homes, they can range from relatively minor to serious concerns. There's a real kind of spectrum of things that come in, and often it's the care home that's actually flagging it up to us. So the care home is saying, we put our hand up, we got something wrong, we want to draw your attention to it, we want you to come in and your support to make sure we don't do it again, we rectify it. So there's always this question in adult safeguarding. You put the training in, your numbers of reports go up. Is that a good thing, or is that a bad thing? And there's always a kind of balance. You know, Darren's right in that the data never really provides us with an answer. It only provides us with better, more intelligent questions. So I think the rate of concerns within care homes has been pretty consistent, but for a number of years within Middlesbrough and some of the other authorities as well. So I think it probably reflects sort of the care homes' adherence in large part to flagging things up to us when things have gone wrong themselves. We've seen a bit of a change over the current year, because we've perhaps seen some things flagged up to us that we would have wanted to have seen flagged up a little bit earlier, and I think that potentially is accounted for by the fact that we didn't have so many visiting relatives and external professionals going in and out of care homes because of lockdown. So what we're looking at is how the data kind of settles again now that we're hopefully going to see things opened up a little bit more in the future. I'll stop there.
Is that okay, David?
Yes, thanks, Chair. Just one other comment. I mean, I'm going back 10 years. I saw personal experience of the care home that, I'm not saying they didn't care, but they just followed the book. They didn't check that the patient wasn't eating. They didn't check that the patient just wasn't on their own for most of the day. I've seen other care homes since then who really do that. So I'm sure things have improved, but it just concerned me. It said 35%. I agree that it could be minor little events as major events, but 35% just seems a bit high to me. Thanks, Chair.
I think if I had a concern, it would more be about people living on their own out in the broader community, where we have much less sort of surveillance is the wrong word, but much less of a view into those situations. It's harder for us to form a hypothesis about whether or not we're getting a sensible level of reporting out there or not.
Yeah, I'd agree with that. Thanks, Chair.
Okay, thank you, David. Councillor Rooney was next. Denise?
Right, thanks, Chair. Hi, I've got two questions. My first one is around the care reviews and the learning lessons. When you start a review, do you talk to every agency that possibly could be involved, rather than starting with the agencies that were involved with the individual? And the reason I'm asking that is it's around Adult C, which was a really, really tragic case. And it was clear that there was mental health issues in there. She had postnatal depression. There was a suggestion of some opioid abuse as well as the alcoholism. And yet I didn't see anything in there, unless I missed it, that talked about the mental health services that may or may not have been engaged with her. And it just led me to think about how you start the framework of the review. So do you look at, it might come from two different directions anyway, but do you start with the person and then go out to the agencies that are involved, or do you look to see if other agencies could and should have been involved with her? Because it's not even in the recommendation about the mental health service, and it just made me think about that. And just a second point, you talk very strongly about domestic abuse, which was obviously a factor in this case as well. And when I've looked at the non-statutory partners on the report, there isn't any domestic abuse agencies listed on that. Has that changed since the report was produced? Thank you.
So in answer to the first question, in terms of the case review, the case is looked at from the perspective of the individual, and then, if you like, the net is thrown out across agencies who may have been involved with that person. In the case of Adult C, I couldn't answer the specific on that, to be honest with you, in terms of which agencies were asked for information. But in essence, the net is thrown out. So in terms of procedure, what would happen is a case would be reported into the board to say this could be a serious case review or a learning lessons review. It would then go to the subgroup. I would also be notified of it to say these are the basic circumstances of it, and then the subgroup is made up of a variety of agencies who discuss the case to see, first of all, if it meets the criteria for a serious case review, and then secondly, they also look at what the scope of that review should be. Then comes back to me, usually with yes or no, we think there should be a serious case review. And then if it's in the case of Adult C, an independent chair would be appointed for that review. And then the scope of the review, including the timescales in relation to which that should be looked at, but also which agencies should be involved, would be agreed. Because obviously the difficulty with these things sometimes is trying to keep the review focused on the issues that have caused or have contributed to either the death or the serious injury, or the way that the agencies have worked together, and trying to keep, particularly with individuals who've got a lengthy history with agencies over many years, trying to keep the review focused and to the point really is a difficult task for the independent reviewer. But in relation to Adult C, in all honesty, I couldn't answer the question around whether mental health services should or shouldn't have been involved, or were involved or weren't. But I can see Eric's got his hand up. I don't know if he's got a...
Like yourself, I wasn't going to make specific comment on the case. I was going to mention the process, because I think this is one of those situations where the fact that we've got 4 local authorities working together in a board gives assurance to all partners. So in the instance that we have an event, a death, a near miss, whatever, with a service user in Middlesbrough, as was the case relatively recently, the head of service responsible for that came to me and said, "This has happened. This meets the criteria, and the threshold is relatively low for us to fill in a form and submit it to the TSAB, and we submit it for consideration, and that is consideration about, do we need a lessons learned review? Do we need a serious adults review or not? That paperwork goes in, and then it's a multi-agency group that considers that. So professionals from Tees and Weir Valley, mental health professionals from the acute hospitals, from police, all sit around, local authorities sit around the table and make a determination about whether or not there should be a serious adults review or a lessons learned review. So it's a Middlesbrough case, but I don't get to make that decision. That's a group of partners from other organisations that make that call, and then Darren has to sign off on that. And as genial as Darren seems in a setting like this, Darren's pretty hard-edged and pretty forensic when he's required to be. So there's a really good kind of solid assurance around that process that other local authorities don't have if they don't have this kind of shared board process. And then once there's a decision that, for instance, becomes a serious adults review, then that subgroup meets again with representation from all statutory partners, and there's a conversation about, right, who knew this individual, who's got records, what report can you bring to the table to explain what your involvement were, and what are the gaps? So are there agencies that we don't have around the table that we need to bring into this? So that's part of the thinking, without talking about the particular case, that's part of that process that is there, is auditable, can be looked at to understand the determinations that group made. If it's a domestic homicide review, then it's a whole other level yet again, because it's the community safety partnership that commissions that. And then, so for instance, we've had an instance recently where we've been considering, are we looking at serious adults review? Are we looking at a domestic homicide review? So it's a kind of broader partnership that would make that determination about domestic homicide review. But it's a very clearly documented, transparent process with a high level of sort of challenge and assurance in there.
Thanks for that. I think that sends some reassurance. It was really about identifying the gap and whether you've got the processes in place to say this is missing. But thank you for that. Yeah.
Certainly the people that we use as independent chairs are highly experienced people, and they, I have to sort of run a bit of a tightrope, if you like, to maintain my independence, because eventually I receive the report on behalf of TSAB in my role. But what I do is I sit in on some of the subgroups as well, and I do influence what the scope of the review should be, etc. But I can say that certainly the last two independent chairs for the reviews that I've been involved with and observed, these are people who've operated at very high levels within their professional lives, if you like, and have now moved on to this kind of work, and they spot exactly the kind of thing you're saying, where if there's a gap in service or something would have benefited from, or an individual would have benefited, those kind of things are absolutely drawn out, and those tend to be the things that then form the recommendations that come out of the reviews. In answer to your second question around domestic abuse, again, it's two really good questions, actually, and I'm delighted to get some really good questions, because I don't always when I come to these sessions, but it's a difficult one when it comes to domestic abuse. So what we do have is we have third sector representation at TSAB, and organisations that cover a range, if you like, of third sector, and I take it it's third sector domestic abuse type organisations that you're talking about. I think the difficulty we would have as a board is that if we were to invite every single third sector organisation to the board, that I'm not saying they're not relevant at all, they absolutely would be, but the meeting as it stands is already about 35 people big, and if we were to do that, I suspect we'd end up with probably a pretty unmanageable meeting. So it's about keeping those agencies involved and engaged, but potentially through other means by other people that are represented, or other organisations that are represented at TSAB. That said, particularly around domestic abuse, As I mentioned, we've become heavily engaged with the work of Safe Lives and the Police and Crime Commissioner's Office around domestic abuse, and I've personally had one-to-one interactions with Safe Lives around the work that they are doing on behalf of the local authorities and all the different agencies involved. So I'm not writing off the potential to have specific organisations represented at TSAB, but it needs to be balanced with TSAB still being a useful, manageable meeting that can actually achieve the business that it needs to achieve. Does that make sense?
Yes, yeah, thanks. It does, and I fully appreciate what you're saying. You know, with the large meetings and the number of individuals and agencies that would come along to something like that. But it was your comments around domestic abuse in particular, and the high level that there is in the area, and yet none of the statutory agencies listed show that there was a domestic abuse involvement. And I was wondering how best we can do that. Now, you're talking about the Safe Lives. I don't know anything at all about that project. I will go away and look at it. But I'm thinking that there is a lot of very helpful information that the domestic abuse agencies can bring to you, because they are generally part of a very, very large network and have access to tools and information and, you know, reports and elements of law that I think would really, really be helpful. And if there's a way of bringing that into the meetings, then I think that would benefit the discussions as well. But I take your point what you said, but I still feel that given the particular element of your discussion there about domestic abuse and how high it is in the area, then it's something we should maybe consider about how we draw that information and expertise in. But thank you.
No, I think actually it's really good to come to these meetings and have someone make you think a little bit as well, because I did mention that one of the things that we're doing, we're working with another agency at the moment around getting the voice of the service user and carer into TSAB. And what I think you're describing is and I've been sort of wrestling in my own mind together with others about how we actually do that. Who would we invite to come and listen to? So I think what you're talking about is a way of getting that voice in through those types of agencies and talking about specific cases that will help us and get that information, if you like, into TSAB without them having to spend their valuable time as well, I guess, sitting in a meeting as well. So I think there's maybe a hybrid that we can look at. So I'm really grateful for you raising the point.
Eric, you wanted to come in?
Briefly, by way of context, the domestic abuse agencies that we contract with and indeed those we don't contract with are all really, really important. And I think we have regular contact with our contracted DA providers, and there is such a high level of expertise, knowledge, professionalism there that we rely appropriately heavily on them. I think it's also important to remember that we have the Domestic Abuse Strategic Partnership that meets, so there is a kind of statutory setting where the local authority and other partners meet with the DA agencies. That feeds into the Community Safety Partnership. So this is not all just sitting with the TS Safeguarding Adults Board. And Dan certainly has been instrumental over the last year in asking the question about how can these partnerships work more closely together to kind of to promote those links. I think the questions about, you know, at the domestic homicide level, then DA agencies, if they're involved, are obviously partners at the table and are just as involved in the process as kind of adult safeguarding, whatever. At the serious adult review level, which is what Darren kind of started talking about in the lessons learned review sort of level, then generally we're talking about the kind of the relatively hard end of the adult safeguarding bit. So the focus is on the statutory partners, but we do bring DA agencies in where that's kind of appropriate. But I suppose the purpose of me jumping in here was to say we talk to those DA agencies in lots of other settings as well, and they're a really important part of our work. That's it.
Okay, thank you. Is that okay, Denise?
Just unmute. Yeah, that's great. Thank you.
Yeah. Okay, thank you. Councillor Walker, you've been waiting a long while.
It's okay. I've been listening quite intently to the conversation. It's been very some of which I was going to ask has actually been answered. So thanks very much to participants. One of the things I would like to ask is, I'm just going to take that down. Is I know that you've given us a location of adult abuse on page page 6 of your report, Darren, but page 11 on our papers. So we've got all these different numbers. And that's this middle part where you say own home 46%, care home 36%, which I think was actually related, was spoken about with Councillor Coop. The thing is, you say own home 46%, and there's no actual types of abuse within that. Obviously, I think that figure would be delved into a little bit more fully, I would imagine, and drilled down to get the types of abuse within the 46% would actually come out slightly. It would give you more information to address. Is that correct? Also, and carrying on regarding the domestic abuse, and we do have a lot of agencies, but a lot of times I see that further on in your report, you work with 13 at some point, which is a housing provider. But I don't think they're the only housing provider that actually has experience with domestic abuse within their tenancies, etc. And also there's a lot of domestic abuse goes out on everywhere, not just in social housing. So I think that's something we need to address. And thank you very much. To conclude with my little piece, is the fact that on the last page of your report, or not quite the last page, where you say see it, report it, and it gives all the telephone numbers, which I think is very helpful. And I would love to be able to share those if that's possible, because I do honestly believe that those numbers, I don't know where they would have been found otherwise. So unless you, like ourselves, given training to go on websites, etc., and delve down for it. But I think those numbers are very helpful, and I find them very helpful to find that number so easy to remember as well. Thank you very much for that. So I don't know whether that's a jumbled up sort of ask a question, but I hope you can answer in some way, Darren. Thank you.
Yeah, no, I'll certainly do my best. Well, I'll start with the last one. In terms of giving out those numbers, absolutely no problem at all, and I would encourage you to do it. Absolutely. The place to direct people to, if people want more information around safeguarding adults and all the relevant information, and all the numbers and all the agencies, is the TSAB website. In November of this year, there was a Safeguarding Adults Awareness Week, and the business unit in particular, and it tends to be the business unit together with Hartlepool, who lead on this on behalf of TSAB, did a whole raft of work, and we've done things ranging from, actually didn't do it this year, but last year, information that went on the back of a Middlesbrough football game, and that reached ever so many people. Various things, the bus stop campaign, where information on bus stops. I've done interviews with local, in Middlesbrough, I did a radio interview with the Asian Network, some of you will know Idris, and I did an interview in central Middlesbrough with Idris that went out to all the people that listen to that. So we do an awful lot of work, is what I would say. And I would personally say it's one of the real strengths of TSAB that I claim no credit for as independent chair whatsoever, because it was all in place before I came. But each of the local authorities and the business unit put an awful lot of work into raising awareness and getting those numbers out there. And I think that is part of the reason why we're seeing the increase in numbers, if you like, of reports, because of the amount of work that goes on. So in answer to your question, please send those numbers out as far and wide as you want, and please let people know about the TSAB website, because all the information anyone could ever want on adult safeguarding is there. In answer to your question around locations of abuse and types of abuse within those locations, the short answer to your question is yes, that information is available. And Eric, as I've said, leads the performance subgroup, and they'll look at that information in a lot more detail to try to draw out, as we've already said, not necessarily conclusions, but what are the questions we should be asking around different types of abuse occurring at different locations. And of course, you can then overlay that with things like age of people. You can overlay it with ethnicity, gender, and all sorts of different things to try to drill down on what our focuses should be. And we do that on an annual basis in terms of what our priorities should be over the coming year. Obviously, the difficulty for an annual report is getting some top level information and data into a report that's meaningful to anyone who would want to read it. So the answer is yes, it's there, and we can get it to you if you're particularly interested in a particular set of data or some information. But it's what we put in the annual report is just to give that sort of high level information. And then your third question was around domestic abuse and where it occurs. And I agree insofar as, yes, domestic abuse obviously doesn't say my former role was as a police officer, and I can absolutely say that domestic abuse happens in all settings, and there isn't a particular type of housing. But again, it goes back to the answer that I gave previously around getting people around the table. Sometimes it's a case of having a manageable meeting. Sometimes some agencies or some organisations are more difficult to engage than others. But that's, in terms of housing, it has been 13 who traditionally, if you like, have been the housing representative on the board. I think, having said that, my history only goes back to October of last year, so I don't know if there's, before that, Eric, if there was any wider involvement with housing. I'd have to defer it to Eric or indeed Dorothy on that one.
Thank you very much for that. Thank you.
Just briefly, Chair, I would, at the risk of embarrassing Darren, I'm sorry to do this, I would remind Darren that Dorothy is no longer Middlesbrough's rep on the board.
Oh, apologies. Yeah, sorry, I had forgotten that.
It's the mayor as our lead member. Two minds whether I should mention that or not, but just it's the mayor who's the lead member and attends for us. Yes, we've had contact with a number of kind of housing providers. I think over the years of working, predominantly 13, but absolutely acknowledge that they're not the only housing provider in the area. We've got loads of data, and we are able to break down, as Darren said, all sorts of criteria. We certainly break down into categories of abuse. That used to be relatively straightforward, but it has broadened out, and our staff now, along with the growing complexity that we see, we do encounter cases of human trafficking, of modern slavery. Self-neglect is now one of the categories that we look at as well. So we break all of that down, but that has to be interpreted against the background of always being aware we don't understand fully the prevalence. So the cases we get reported to us, we don't know whether that's 40%, 60%, 70% of the activity, the abuse in the sense that goes on. So you've got to add that caveat to the data. But yes, we certainly look for trends, and we spend a lot of time, because we've got the ability to do it, looking at comparisons across areas, which gives us a huge strength.
Thanks very much for that. Thank you. Thank you, Chair.
Okay, thank you, Jeanette. Right, I think we're finished now, so I'd like to thank Darren very much for that, and we shall move on.
Thanks, Chair.
Discussion is item number 6, which is a discussion on social housing. Following a request from the Vice Chair, Councillor Wilson, members are asked to participate in a general discussion around the topic of social housing for residents. And I ask you to refrain from personal experiences because we're going out live and we don't want anyone to cause us any problems, for want of a better expression. So I'll hand you over to Councillor Wilson here to open the account.
Thanks, Chair. Basically, just some things I've come across.
Go ahead, Graham.
Sorry?
Go ahead.
Right. Just some things I've come across over the last 18 months there. Social housing, bungalows, it's like an age discrimination thing where some people want a bungalow, they've got medical needs to go along with this, but because they haven't got the age, that they're younger than the 55 criteria for they get one of these bungalows or whatever, but they've got the medical needs, but they can't get the bungalow because they're not got the age. It's quite widespread. I know of an elderly couple, because the one of them, the gentleman, he's quite frail, but he's quite all right in his mental health ways. He can self-medicate as soon as his partner can. But because they didn't have a sort of medical package to go with them, they couldn't get a bungalow. He needs like a wet room. He can't manage to get in out of a bath easy enough. So he needs that wet room. I know of another couple, quite the same thing, can't manage a bath very well. He needs a wet room. But they're only very young. They're in the 20s. They're sort of middle 20s, but they need a wet room. Can't manage stairs properly, the same thing. I know another lady with a son. he has problems going downstairs. She has medical problems with the heart, 2 problems with the heart. She struggles with the stairs. She's applied for bungalows. She can't get them. I'm just wondering how widespread it is across the town, across each ward. It seems to be a lot of people that have come across, 4 or 5 people there. I don't know how many people have got right across all over the town. They've probably got the same problems. How far widespread is it, and what can we do about these social housing? Can we get to this criteria of 55-year-old before you can apply for a bungalow? If you have got the age and medical conditions to go with it, it appears you've got to have medical conditions and you've got this age limit to go with it. I don't see why that should be. You know, I don't know what the rest of the panel think. Thanks, Chair.
Okay, I know Councillor Rooney wants to come in there. Eric, have you got anything to say on this?
Gosh, I think there was probably a whole range of situations and issues covered there by Councillor Wilson. I mean, I don't have the criteria for the various forms of housing to hand. I think there's a lot of complex processes around who's eligible for what in terms of social housing, and I wouldn't deign to comment on that. That would be for our housing colleagues to comment on. I think as far as things like, you know, for instance, wet rooms are concerned, depending on the needs of an individual, there are processes in place for adaptations to be made, for money from local authorities, disabled facilities grant to be spent on establishing adaptations or extensions or whatever. But there's a whole host of criteria that have to be worked through to do that. I think I'm a little hesitant at assuming that there's a problem in the way that it's described. I think there's probably quite a lot of things that would need to be unpicked there to support the panel in determining whether or not there is an issue and how we really would articulate that. So I would kind of urge caution. There's maybe a little bit of exploratory work to be done. That's all, Chair.
I come back on that, Chair.
Councillor Rooney wants to come in now.
Yeah, go on, Jim.
Go on, Councillor Rooney.
Thanks, Chair. I mean, you started the meeting off by saying we shouldn't be referring to individuals, and I think, you know, Councillor Wilson then went on to talk about individuals, although he was demonstrating some particular aspects of that. We've got to remember that housing associations are not local authorities, they're private companies, and as such, unless they have an agreement with the local authority, they are free to allocate their properties to whoever they want. They have to publicise their allocations procedure, and that is publicised, and each housing association, and there are a number that work in the Middlesbrough area, will have its own criteria and will work in, you know, cooperation with the local authority where that's appropriate. So I don't think that we can demand or insist on a certain level of allocation, and the reasoning behind their criteria will have been consulted on widely with their residents and any others who want to be involved with that, and that's the normal process. I think what might be helpful is if we could at some point, if this is something that the people want to take up, is to look at our staying put agency and how the DFG works in process with that, and how we assist people who have particular needs to get the more suitable adaptations or housing. But I don't feel that we can push local housing associations into allocating to specific groups when there already is a very broad allocations policy. Thank you.
Thank you for that, Denise. Councillor Davison wants to come in.
Oh, I'm having trouble unmuting there. Yeah, I just wanted to say we do have at Middlesbrough Council the Staying Put Agency, which does an immense job around the town with adaptations for people. And I think maybe we as a group could have them come and tell us exactly what they can and can't do to help people within Middlesbrough. Thank you, Chair.
Thank you, Councillor Davison. Graham, do you want to come back in?
Yeah, just briefly, Chair. The housing associations, I'm talking about the new build now. We have quite a few new build bungalow sites across the town. It's not so much the wet rooms, it's the ground floor access they need, a lot of these people. But there's I believe, an agreement between the council and the local housing plan for to meet these criteria, to make these criteria up to they seem to think it's fair. It is fair to a point, I agree. But I think we just need to be a bit more divided on the number of bungalows, because they don't see there's not enough ground floor access. There doesn't seem to be an awful lot of bungalows, new bungalows where it meets the criteria for the number of people that need these places. Same as ground floor flats, even. Maybe it's not just bungalows, ground floor flats that we do need. The criteria to meet these for these people that do need. I'm not sure how they're disabled, they just need to be able to have ground floor access. I think that's the point I'm trying to get across. Thanks, Chair.
Okay, well, I don't really think we need to talk much more, but I think Councillor Rooney has made a good point in saying it's not an adult social care topic. It's a housing topic, I think, and Eric would probably agree with that. So I think we can move on if everybody, unless anybody else wants to say something. No, right. Item number 7, overview and scrutiny board update. The following matters were considered at the last meeting held on the 7th of December. Executive Forward Work Programme, Executive Member Attendance at OSB, Deputy Mayor and Executive Member for Culture and Communities, the Chief Executive's update, Scrutiny Chair's update, and the Revenue and Capital Budget projected outturn position as at Q2 21-22. Our next meeting is the 9th of February, but before we finish, we have two subjects, which have two topics. We've only 3 more meetings to go, and we have 2 topics, and these 2 topics would probably not fit into 3 meetings. So 2 topics are the role of the voluntary community sector in supporting adult social care, with a focus on COVID-19 recovery. And the second topic is the adult social care finance, residential care, and ensuring value for money. Can I ask the members to say what they think would should be the best for the next 3 meetings, please? Councillor Rooney, you're first on.
Thanks, Chair. Can you remind us what your second one was? The role of finance. I can't remember the details of that
The
bit.
second one was adult social care finance, residential care, and ensuring that we get value for money within the adult social care.
Sorry. So is that about commissioning?
No, it was about the money we pay to care homes. Are we getting value for money, or is the council getting value for money from the care homes?
Right. I mean, I don't know whether Eric wants to come in there, but I'm not sure that's something we could investigate, because that would be down to individual contracts. Anyway, Eric.
Sorry, Eric, do you want to come in now?
I think we have processes in place for establishing the fee rates that we pay to care homes, and we have mechanisms in place to look at quality there, as does the Care Quality Commission, and we have processes in place to take action when care homes fall short of the kind of standards and quality. My generalizing, I think care homes have had an incredibly hard job through the pandemic, and it remains incredibly difficult at the moment. We roll into a new year where we are looking at additional funding around workforce coming from government and trying to bottom out what fee rates will be in future for care homes, and what by necessity care homes will need to pay their staff in order to secure staffing to retain their services. We're kind of in the thick of that at the minute. It feels like from my perspective, and it's the panel's call, but it feels like a sort of inopportune moment, I think, to jump into that sort of investigation at a time of such change, and at a time where we want to be absolutely supporting the care homes in continuing their services and supporting the residents they've got. So I would be a little bit resistant to doing that particular piece of work at the moment, however we articulate it, Chair. But again, it's not my call as to it.
Okay, thank you. Denise, you want to come back in?
Yeah, thanks. Yeah, thanks for that, Eric. What I suggest then is we go back to your first one, because I'm not sure. I've slept and we've had Christmas. If we've had a lot of informational presentations from the voluntary and community sector, and it might be helpful to listen to them in respect of this. And I think that would quite nicely round the year up then. But as I said, that's just, my suggestion back to the group.
Yeah, thank you for that, Denise, especially with the COVID and the outbreaks of the modern COVID, and it's escalating, so it might be a good one. Anyone, any suggestions or anything to say about it? So it's the role of voluntary community sector in supporting adult social care with a focus on COVID-19 recovery. Yes, Councillor Cook?
Yeah, I would agree with that, Chair. I think Councillor Looney is quite right about that. I think that's the direction we should head in. Thanks, Chair.
Thank you. Councillor Higgins?
Yes, I also agree. I think that would be good to look at, and it would be a very interesting subject. So thank you, Councillor Roney.
Yeah, I think we're going to go with that. As I say, we only have 3 more meetings, February, March and April. So we're going to go with that. Chris, can you mark that down as our next 3 meetings?
I will do, Chair. I'll start making arrangements and contacting some of those organisations after this meeting, ready for February. Okay.
Okay. I would like to thank everyone again for your attendance and your input. Thank you, Eric, as always. Any other urgent items, which I haven't got any. So if anybody hasn't got any, we can finish the meeting, and thank you very much for your attendance. We'll see you in February. Thank you all.